Hello everyone, Drew Watts here, Business Development Manager for Restorative Oxygen Care. Back again with our Medical Director, Dr. James Collier.
Hello.
And hyperbaric oxygen therapy is currently approved for 14 different conditions.
Good.
Many times in our facility, we get other things approved with appropriate documentation, but I wanted to talk specifically today about osteomyelitis, and more specifically chronic refractory osteomyelitis. So that's one of the approved conditions. So explain briefly what is chronic refractory osteomyelitis.
Osteomyelitis is the medical name for infection that involves bone. The bone is actually infected. Bone infections are difficult and slow to heal, so they can then become chronic infections. And sometimes these chronic infections are also unresponsive to other attempts to heal them, so they are refractory. So you have chronic refractory osteomyelitis, which is a indication for hyperbaric therapy in almost all insurance plans. The way the oxygen contributes to this is we increase the oxygen level in the bone, because the bone is relatively poorly oxygenated because not a lot of blood flows through the hard portions of the bone. So when we increase the oxygen content in the bloodstream itself and in tissues around the bone, some of that oxygen will in fact percolate into the bone. That is beneficial because most of the germs causing these infections do not like oxygen. They're not designed to live in a high oxygen environment. So if we make the environment high oxygen, it causes them to stop growing and reproducing, or actually kills them outright.
That's fantastic. So if somebody were to come to us with a chronic refractory osteomyelitis diagnosis, how long might they have been in care trying to treat this infection?
Usually a minimum of 6 weeks.
Okay. And obviously those infections can accelerate their growth, or their progression. In some cases they can progress, I guess, the wrong way, but
yes.
Yeah, very quickly, right? So those things can go south, I guess, if you will,
yes.
in a hurry.
Yes.
Gotcha. Okay. Well, and those types of things, those are usually going to be referred to us from like an infectious disease, or
yes, we will always have to coordinate with an infectious disease provider, because antibiotics must be part of the program. Usually we are coordinating with a surgical provider, because sometimes the bone has to be debrided, parts of the bone that are badly infected have to be removed, or there may be devices planted in the bone that have to be removed to deny hiding places to germs.
Right. And so if you're watching this video, I'm sure you can understand with the more complicated some of these conditions are, the more that team approach, and we've got to have multiple appointments to with multiple different disciplines.
Yes. Hyperbarics alone is very unlikely to resolve an infection.
Correct. And so, our office staff works very hard to help manage the patient's schedules to make sure that they can be compliant with, obviously, their hyperbaric treatments, but also making sure that they are making all of their other appointments, because Dr. Collier said this is a standalone, it's a fantastic modality, but it is not the answer to all the questions by itself. Okay. Well, I hope everybody learned something about chronic refractory osteomyelitis. If you have any questions, you can check out our website or give us a call at the phone number below. We'll be happy to answer those questions for you.